Afternoon, everyone. Thank you for that wonderful introduction. So today I will be presenting to you about the work conducted in regards to polycystic ovary syndrome research in Trinidad. And this has been conducted at the University of the West Indies in collaboration with PCOS Challenge, which is Sasha, who is the director and founder of PCOS Challenge, various Rotary organizations in Trinidad, Rams Logistics, Caribbean Eye Care Institute, and also the Diabetes Association for Trinidad and Tobago. This research has been funded by the Campus Research and Publication Fund at the University of the West Indies over the last, let's just say, 6 to 7 years in terms of the various avenues of research we have conducted. Now, what exactly is a polycystic ovary syndrome? So, polycystic ovary syndrome is also referred to as PCOS, and it is the most common endocrine disorder affecting reproductive aged women, with impacts from adolescent stage throughout until postmenopause. According to the World Health Organization, which is the WHO, it affects 8 to 13% of women, still with 70% underdiagnosed. Now, PCOS has a complex etiology, so it has clinical presentations that are heterogeneous with reproductive, metabolic, and psychological features. And some of the features that may be present in women with PCOS would be things like cystic ovaries, hormonal imbalance, such as luteinizing hormone, which is LH, follicular stimulating hormone, which is FSH, irregular menstrual cycles, acne, weight gain, hirsutism, and hirsutism is like excessive hair growth, which you may find on various parts of your body, and also low AMH, which is referred to as anti-Mullerian hormone. Now, anti-Mullerian hormone is a biological test, which is actually a biochemistry test that we use to be able to test ovarian status in terms of reproduction. So for persons that are looking to get fertile or to check their fertility, we tend to look at this particular test. Now, PCOS is also associated with further complications such as infertility, insulin resistance, type 2 diabetes, cardiovascular disease, and this also has a mental health burden on women with the condition. Initially, PCOS is believed to have been around from ancient times. However, the only first documented report of PCOS was by Stern and Leventile. Actually, that's what they initially called the syndrome, the Stern and Leventile syndrome, which was in 1935. And they documented 7 women with a variety of clinical symptoms. Since then, the name has been given as it is right now, polycystic ovary syndrome, and there are still currently some debates with regards to change in name. However, the diagnostic criteria over the years has been based on these following criteria. So first we have the National Institute for Health, which was in 1990. And we also have the Rotterdam criteria and the AE, which is androgen excess PCOS society criteria. Now, in diagnosing a person, once they follow these criteria, you have to also take into consideration that you exclude certain criteria that mimic the condition. So criteria such as persons that have abnormal thyroid levels or hyperprolactemia, before you actually take into consideration these. So with the NIH, if a person has oligo-ovulation, and when we refer to oligo-ovulation, means like a person is not able to release that oocyte on a regular basis, or this might present as irregular menstrual cycles, mixed menstrual cycles, also absent of menstrual cycles. So in adults, we are expected to have days. So if you fall, let's say, less than 21 days and then over 35 days, then you can be considered as oligo-ovulation. Also, if you experience hyperandrogenism and or hyperandrogenemia. So whether it is you had like clinical aspect or even the biochemistry aspect of androgen levels, then yes, then you follow the NIH criteria. The Rotterdam criteria would include that if a person had any of these two criteria, then they're considered to have PCOS, possible PCOS. So this includes oligo-ovulation or anovulation. And when we say anovulation, this is like a person is not ovulating. And this is something you would tend to find in patients or persons that are infertile. Also, clinical and or biochemical signs of hyperandrogenism. So clinical signs of hyperandrogenism, we are referring to persons that may present with hirsutism, which may show like excessive facial hair growth over the mush area on the chin, between the breast area, lower back, on your hands, on your legs as well too, or biochemical signs of hyperandrogenism. And this refers to things such as high androgen levels in the human body, which would be like high testosterone levels, and also polycystic ovaries. The AEPCOS criteria follows that a person must have hyperandrogenism, which would be hirsutism and or hyperandrogenemia and ovarian dysfunction. And they must exclude also like any other androgen excess related disorders. So it's very important when being diagnosed with PCOS, you have to be able to understand that there are also exclusion criteria and make sure that certain conditions do not mimic these. Otherwise, you can end up following a misdiagnosis. Now, there was also recommended, like which was last year in 2023, a new internationally based evidence guideline, which I would suggest that persons actually go and check out. And here is where it is they highlighted the use of the mental health aspect on persons that has PCOS, and also the use of AMH in terms of diagnosing PCOS with regards to some persons not being able to have access to an ultrasound. So you can also diagnose with AMH. Now, when diagnosing PCOS, it's a combination of being able to look at physical exam findings, having a history examination on that patient, ultrasound to be able to determine like the cystic follicles, and also blood tests. So those blood tests will be such as your AMH, your hormonal levels, and then some other blood tests which are tailored specific to each and in every one's individual needs. Now, PCOS treatment is tailored to each woman's needs, symptoms, and situation. Currently, because of that tailorment, what happens is that PCOS prevalence varies across different demographics, also different populations. So you will see from, let's just say, for example, like say Mexico, 6.0 prevalence, till probably about the US, which is a 19.6 prevalence, even to India, 22.5% prevalence. However, there are many populations in which it is the prevalence of PCOS varies, yet there's no data that estimates the prevalence of PCOS in Trinidad. And this is something that we've been working on, and I'll share with you a little later. PCOS research, because PCOS affects 1 in every 10 women of reproductive age. And because of its association with infertility, type 2 diabetes, cardiovascular disease, and other mental health conditions, what happens is that it has a significant healthcare cost. And because of this, there are so many unknowns that we need to be able to conduct research. The key objectives of PCOS research is that you need to be able to identify that there are genetic, environmental, and hormonal factors that contribute to the condition, being able to diagnose and develop proper diagnostic criteria and tools in terms of assessing persons of various populations across diverse races and ethnicities, evaluate treatments and management strategies, investigate links like with these related conditions and also comorbidities, help increase awareness among healthcare providers and in the general public, and also be able to examine that psychological impact that it has on the persons that are diagnosed with PCOS, and not only them, but the persons that are around them as well too, and also be able to foster interdisciplinary and international collaborations. So the current trends in PCOS research tend to focus on these, which it is what I just highlighted in terms of like the genetic and environmental factors that cause about the condition. And then also like there are findings in terms of being able to find like the impact of lifestyle interventions. So here at the University of the West Indies, we've been conducting various types of research when it came to PCOS. So we've conducted animal model research, which is when we say animal model, we're referring to, so we would use like rats, where it is these rats now, they have similar physiological features of the human body. So because of that, we're able to induce them with polycystic ovaries and then conduct experiments to be able to help understand the condition a little better. Human researchers, so we've conducted community research, created awareness and education seminars, and also mentor students on PCOS research, adolescents and also adults. And this has involved a collaboration across diverse disciplines. So just to share a little bit with you about the animal and human studies we've conducted. So at my PhD level and before my PhD, we would have conducted some research where it is we looked at the effect of electromagnetic radiation on PCOS. And this was developed because a particular radiation was being used and it was approved for the use of glioblastoma, which is cancer in the brain. And the use of this particular field, which is referred to as the tumor treating field, it was gaining a lot of recognition in terms of the treatment of various cancers. What happened is that they actually started to test it on recurrent ovarian carcinoma. So we decided, okay, what happens if it is you try something similar on non-cancerous cell tissue? So this is what it is we would have done. So we were able to obtain ethical approval. We induced animals with, which was rats, laboratory rats that was ethically approved. No harm was issued onto the animals them, and they were divided into various categories or groups, as we would call them. So we would have a PCOS group, we would have a control group, and then we would also have like a PCOS and EMR group. Throughout the year 2017 to 2020, we conducted several animal experiments, and these experiments were then assessed based on like the receptor level, using immunohistochemistry to be able to see what exactly like is occurring at that cell inside your cell. You have something called your receptor level. Then at the cell level, tissue level, and then also being investigating the hormonal levels. So, I mean, I don't need to go into details like the procedures, but these are just the procedures that we would have used in terms of assessing these. Now, in our assessment, we also use a lot of histology where after these animals were they were induced with polycystic ovaries, they were also subjected to electromagnetic radiation. And following a certain period of which it is they were subjected to this radiation, after they were euthanized and then they were used for like to be able to investigate their ovaries. And we were able to identify and make comparisons, say, between control, which would be animals that had no polycystic ovaries as compared to animals that just had polycystic ovaries, or animals that were just exposed to electromagnetic radiation, and animals that were exposed to developing polycystic ovaries and also electromagnetic radiation. And it's important to know that there are several animal models. So this was just one of the most basic models that we use, which was the estradiol valve rate model. The key findings from our initial results were that there was no effect of EMR in terms of the feed intake and the body mass of the animals, that those things did not change. We also looked at the hypothalamus, your pituitary, and your ovary, and that's the axis that is responsible for follicular cyst development. And we were able to find that there were no observable effects in terms of the arcuate nucleus. That's a particular area in the hypothalamus that's responsible for stimulating the pituitary. And then we also found that there were follicular cysts, a reduced follicular cysts. So this is just a graph from one of our studies where you can see these are our control rats here. And then also here we had estradiol valve rate, so which was the model, and we needed to make sure that yes, they were developing cysts. Then we had a pure electromagnetic radiation, and then electromagnetic radiation and follicular cysts. Now, this study was just the beginning of our studies, so it meant that there's still a lot of, since it's the first of its kind, what happens is that there's a lot of limitations with regards to this particular study. So the results are not 100% conclusive. conclusive. Now, these are the scientific publications that have resulted from it, where it is we looked at the effect of electromagnetic radiation developing in terms of the hypothalamus and the pituitary ovarian axis. Recently, we published, just at the beginning of this year, novel alternative treatments as well too. Following the animal treatment, we went on to next was to be able to conduct the first human research in terms of the prevalence of PCOS in Trinidad. And this is where we actually joined with Sasha, who you all would have met earlier on. So this was a prospective cross-sectional community-based study. It was ethically approved by our ethics committee here at the St. Augustine campus. And during this time, we recruited 250 participants of reproductive age, which was between the ages of 18 and 45 years. Now, these persons were recruited from across 8 major geographical locations across Trinidad, and they had to follow a certain criteria. So our inclusion criteria was that they needed to verbal and written consent. And since it was a randomized study, meaning that we took like from these 8 geographical locations, we chose specific areas, and then we took every 10th house, so that person. So we were only able to select one member of each household randomly. Our exclusion criteria would have been persons that did not fit this age bracket, which would be less than 18 or greater than 45 years of age, family members in the same household, pregnant and postmenopausal women, and women that would have undergone certain surgical procedures like hysterectomy or that would have affected the results of our study, and also unwillingness to participate in this study. So following verbal and written consent, we collected data. First of all, we used a standard clinical report form where we assessed the socioeconomic data of a person. We also issued a Ferriman-Galloway score assessment. So this Ferriman-Galloway score assessment, as you can recall at the beginning of this presentation, where we look at hirsutism. So hirsutism can be at different parts. It can present at different parts in the human body. And there was a scoring method in which it is you are able to identify the level of hirsutism, because PCOS is considered to be associated with high levels of androgen. We also used the SF12 questionnaire to be able to identify the physical and mental component aspects of PCOS, the Beck's depression inventory, and the Epworth sleepiness assessments. Anthropometric measurements were collected. So here you can see where we were on the field at different locations throughout Trinidad, where we would have persons assessing them for their collecting data on like their weight and on their height, hip to waist ratio. And we also collected blood. Now, the results, which are preliminary results from this study, this community-based study, showed that, first of all, we needed to be able to categorize or group our participants into certain groups. And we followed the National Institute, which is the NIH Health Criteria guidelines. And we categorized patients based on whether they had menstrual dysfunction. Do they have clinical hyperandrogenism? And clinical hyperandrogenism was referring to the excessive hair growth. And the third category would have been clinical hyperandrogenism and menstrual dysfunction. So if patients or participants had a clinical hyperandrogenism and a menstrual dysfunction, then it meant that they were more likely to have a PCOS based on the NIH criteria. And then also we used our control group, which was persons that did not have clinical hyperandrogenism nor menstrual dysfunction. From these results, our preliminary results showed that there was a 7% prevalence of PCOS in our country, and PCOS was also found to be associated with acanthosis nigerians, infertility as well too. Now, something that's also very important is that even though we found a 7% prevalence of PCOS, what happened is that we did not assess the biochemical parameters. So when we assess the biochemical parameters, we are expecting that this value may definitely increase in Trinidad. Another aspect that we looked at was the socio-demographic predictors of these clinical presentations. So when I refer to clinical presentations, I'm referring to whether a person has menstrual dysfunction, clinical hirsutism, or whether they are categorized as either, or having both. And what we found was that higher income levels reduce the odds of having menstrual dysfunction. So if you look at this table here, and this is just part of our assessment results here, where you would look at the socio-demographics in terms of like age, their income, marital status, and there are some other factors as well too. And here we were able to find that there was a significant, now why we would say significant is because once this p-value was less than 0.05, we also found that menstrual dysfunction and hirsutism, which is your clinical hyperandrogenism, was positively associated with depression. So it was associated with depression, and from this we then also observed that the physical health outcomes had no significant associations. However, the presence of this particular, which is like the persons that may possibly have PCOS, was correlated with a lower score. With regards to the mental component, compared to women who reported neither feature, they showed also a significant correlation. So there was a significant impact, mental health burden on persons that had possible PCOS in our country. This work has been presented, well, it was presented last year at the AE-PCOS Society. This was in Rotterdam, and also another part of this work as well too is being presented this year at the AE-PCOS Society again, this which is in New Zealand. And also we have like a publication as well too that is waiting to be published. It was also presented at the University of the West Indies Research Day as well too, where it received some awards as well. So some of the data here we were not able to share with you because it has not been published as yet, so we needed to be a bit discreet in terms of the information that we were sharing. But most important, if you can recall that initial prevalence map, you would see that now we actually have some data and some statistics for the prevalence of PCOS in Trinidad. Now, in our upcoming research projects, we are also focusing on the mental health, so both mental and reproductive health of adolescents in Trinidad. And the purpose of this is to be able to assess reproductive health knowledge among secondary school students, be able to evaluate their mental health status and their coping mechanisms, and also identify correlations between reproductive health knowledge and in terms of like the practices and mental health status. Because according to the WHO, which is the World Health Organization, it's very important to start assessing adolescents for certain diseases, because you can actually start prevention. You know, you all ever heard the word prevention is better than cure. Okay. Now, expected outcomes or benefits of this upcoming study as well too is to be able to have comprehensive data on the reproductive and the mental health aspect faced by adolescents. So we will have the first set of data in terms of adolescents as well too, and to be able to have more targeted educational programs and support services as well too. We also have another research upcoming as well too. Well, this is actually this is currently being conducted by some of our medical students at the Faculty of Medical Sciences, where they're assessing the biochemical parameters of women with PCOS. So in terms of like their follicular stimulating hormone, luteinizing hormone, also AMH is supposed to have been included in here, and being able to like assess their metabolic parameters. So their glucose levels, insulin resistance, their lipid profiles, inflammatory markers as well too. And to use these to identify any type of correlations here in Trinidad with regards to like the clinical manifestations presented. So thus far, there's been a lot of accomplishments here in Trinidad with regards to PCOS awareness. We've had a lot of persons and organizations have joined the bandwagon with us. Last year, we conducted an international webinar where we hosted over 24 countries, and we had Professor Ricardo Aziz, which also made news as well, to where he helped educate the general population, not only the general population, but also clinicians as well, and scientists about PCOS. And then we conducted webinars for adolescents last year and this year. We've also had a radio talk show with the Diabetes Association for Trinidad and Tobago. And then just recently, which would have been just weekend, we also were highlighted for the work that we have been doing with regard to PCOS awareness and education. We've received several awards, and this here you can see with Sasha and Professor Aziz. This was at the Netherlands last year when we presented our first research ever with regards to Trinidad in terms of PCOS prevalence. And then here, this is our other collaborator, this is Dr. Sundaram, and this is Dr. Coburn and myself here when we presented at the Research Festival at the University of the West Indies. So I would like to thank you all very much, and I will now hand over to Ms. Sasha Uti, who will continue.
Hello, everyone. Good evening. My name is Sasha Uti. I'm founder and executive director of PCOS Challenge, the National Polycystic Ovary Syndrome Association. I'll just speak very briefly so our next presenters can go ahead and speak. I'm Jamaican and very excited that we're doing all of this work in the Caribbean to spotlight women's health and the importance of women's health. So our organization, PCOS Challenge, I'll just share one slide then because we're short on time. So what we do is advocate and educate about PCOS. The organization was founded after my own diagnosis with PCOS and the lack of options for PCOS patients. And I found out that it was a global issue that needed to be solved. And patients are the ones who have personal experience, have lived experience, and we're very much invested in creating the change. So we welcome other organizations partnering with us on research in women's health, in PCOS, but also in women's health broadly. With that, I will turn it over, and I'll just actually go to the last slide so you can see how to contact me at PCOS Challenge and info@pcoschallenge.org. So congratulations to the rest of our speakers, and thank you for inviting me to be a part of this.